Thank you for joining us this afternoon. Welcome to our first Apple Health Expansion webinar, where we will be discussing the upcoming Immigrant Health Program. This webinar is being recorded, and by staying in this webinar, you consent to being recorded. My name is Sarah Tunnell. I use she, her pronouns, and I am the Senior Project Manager for the Apple Health Expansion. This Zoom event is in webinar mode. Attendees will not have access to their microphone or camera during this online event. Your voices, likeness, or images will not be captured. Special thanks to Shelley Hansen for ASL interpretation this afternoon. Closed captions are available in English and Spanish, and we will share those closed captioning links several times throughout the webinar. There will be an opportunity for questions after the presentation. Next, I'll introduce you to our presenters. Your presenters this afternoon are Becky Carroll, Deputy Director of the Medicaid Programs Division at the Healthcare Authority, and Joan Altman, Director of Government Affairs and Strategic Partnerships from the Health Benefits Exchange. Before we officially get started, there are a few housekeeping slides to go over. As I mentioned, this webinar is being recorded and will be posted to the HCA Apple Health Expansion webpage the week of December 4th. The slides will be posted tomorrow on the Apple Health Expansion webpage. There are live captions, as I mentioned, in English and Spanish, and we'll provide those frequently in the chat. At the end of the presentation, we will provide a link to a survey asking for more information in future topics and language translations. In addition, there are some Zoom features to discuss. Your chat is disabled in webinar mode. You may submit questions throughout the presentation using the Q&A feature. These answered and unanswered questions will be used to develop the first FAQ document, which will also be posted on that Apple Health Expansion webpage. All web pages and additional resources will be shared at the end of the slide deck. And now I'm going to pass it to our first presenter, Becky Carroll, who will start with our background.
Good afternoon, everyone, and thank you so much for joining us today. Really great to see the participation that we have. We're going to start a little bit about talking around the background for immigrant health care here in the state of Washington. So as we move forward in the slide deck, we'll kind of note here, currently there are several programs under the Apple Health umbrella that provide coverage to individuals who are not qualified for federally subsidized Medicaid because of their immigration status. These programs include medical care services, emergency medical, Apple Health for pregnant individuals, after pregnancy care, and Apple Health for kids. What we'll be talking about this afternoon on this next slide here are two additional expansions. These mark significant investments by our legislature in reducing the number of uninsured here in the state of Washington. The first program, which launched on November 1st, and our Health Benefit Exchange partners are here to discuss in detail later on, is the Qualified Health Plan and Dental Plan expansion. Again, these are plans that are eligible or that uninsured, undocumented individuals are eligible to purchase on the Health Benefit Exchange. Like I said, they launched November 1st. And that coverage will begin January 1. What I'll be diving into a little bit more is our Apple Health expansion. And this is our Medicaid lookalike program. So this is no cost to individuals who qualify, are eligible, and enrolled in the program. This new program will start on July 1st. As we think about immigrant healthcare coverage in the state, it's really important to sort of understand the current state. So this slide kind of gives you an overview of the different programs in that first column. And then across the columns there, you'll see different immigration statuses and whether or not those statuses are eligible for the programs over on the left. I'll just pause here for a moment too and remind those who are just joining, if you need closed captioning services, those are available in both English and Spanish. And the links for that are available in our in the chat right now. All right. So who is uninsured in the state of Washington? So on the next slide, it really highlights here, right, that being an undocumented immigrant is the strongest predictor of being uninsured. And so you can kind of see here, US born citizens, naturalized citizens, legal immigrants, and undocumented immigrants between 2010 and 2021. The next slide really gives us an idea, right, of who these individuals are. So there's about 410,000 uninsured individuals in the state of Washington, and 25% of those are people who are undocumented. You can see that there in the orange portion of the pie graph. The next slide shows this information in a slightly different way, right? So as we look at this state map, it kind of shows, it definitely shows rather, where all of these individuals reside. So these darker blue or teal colors, depending on how they show up for you, indicate higher density population areas. So in 7 counties, anywhere from 32 to 64% of uninsured individuals are undocumented. So you kind of see a really good concentration sort of in the center of our state. This next slide gives us just a little bit different look at the same information. About 1/3 of Washington's uninsured, undocumented population earns at under 138% of the federal poverty level. So you can see them over there in that lightest blue or lightest teal color in that pie chart. So kind of thinking through all of those pieces, this next slide really talks about what we know. So when we examine that information, we recognize at the state here that the primary challenges, right? There's 3 listed here. I'm sure we could go on, but I think the biggest one, right, is affordability. Cost is a barrier to those who are seeking healthcare, followed really closely by privacy concerns and trust, and then really understanding the importance of healthcare and how to navigate the healthcare system. So really what we are going to talk about a little bit today are some of the privacy concerns, where we will address those. We're really looking to work with community-based organizations and trusted community messengers to help us talk about both of these new opportunities with the population that we look to serve. So let's have a little bit deeper conversation about what Apple Health expansion looks like. So we'll start with the background of this initiative. Back in 2022, the legislature provided funding to operationalize the program. It really just directed Healthcare Authority to prepare to implement Apple Health expansion. In 23, they came back and provided funding to operationalize the program and directed the agency to implement on July 1st of 2024. In that budget proviso or direction, the legislature directed Healthcare Authority to develop a program that's equivalent to Medicaid healthcare coverage and available to uninsured adults who are ineligible for other federal assistance. A couple of key things that you'll see here in the blue bulleted points. The program funding for Apple Health expansion was less than what the agency requested. We recognize that we will have this new program, but there will be more immigrant community members who could and should be enrolled in the program than we have spots to support. So that is a key area that we'd like to highlight for folks so that there's some real understanding that this program, while it will provide full scope coverage, will be limited in the number of enrollees that we're able to support. As we move into the next slide, we'll be talking a little bit about eligibility. So as I noted before, the legislature directed us to develop a Medicaid lookalike program for adults 19 years of age and older. They need to have countable income under 138% of the federal poverty level. They need to not qualify, so they're not qualified for other Apple Health programs based on their immigration status. They are also not eligible for federal advanced premium tax credit through the individual market. So, like I said, the implementation of Apple Health expansion will provide a full scope coverage option for individuals who are eligible, so they meet the requirements that I just discussed, and they're over the age of 19. When we think back a couple of slides, and I talked about the Apple Health programs that are currently available to the population, we have medical care services, Apple Health for pregnant individuals, after pregnancy coverage, and Apple Health for kids. These full scope programs will remain in place. Individuals enrolled in these programs will remain in those programs. So there's some consistency with their care. As individuals age out of Apple Health for Kids, or their 1-year term after their pregnancy has expired, they will be enrolled. So we'll look at their eligibility again, and we will enroll them into the next available program. If Apple Health Expansion is the best next program for them, they'll be enrolled in that program as long as there are spots available. This process, so you'll note here, again, program policies here, wherever possible, HCA is going to use the same eligibility, enrollment, redetermination, renewals, and appeals procedures as we have today in Apple Health. So really staying true to the legislature's direction that we provide an Apple Health Medicaid lookalike program. Most of the funds, rather, for Apple Health Expansion are general fund state dollars. In our Apple Health federally subsidized program, our Medicaid program today, we receive a federal match, meaning the state pays part and the federal government pays the other part. Apple Health Expansion won't qualify for that, but there are some services that the federal government is willing to match. One of them is emergency medical services. And you'll probably remember that from one of the first slides I went through. Emergency medical services are just that. They cover hospital stays, some cancer treatments, dialysis, and post-transplant services. So really emergent healthcare issues. For individuals who are enrolled in Apple Health Expansion, the agency is creating a methodology that we can pull down that federal match or request those dollars, right, and offset some of the money that we spend in Apple Health Expansion. We're looking for every possible way we can to spend as many dollars to cover as many individuals as we can in the program. So we'll move on to the next slide. And I think in this one, we're really talking about the covered services. So when I say a Medicaid lookalike program, what does that mean? So we will be covering physical and behavioral healthcare services, and those will be administered by a managed care organization or an MCO. That is very similar to the way that we cover Apple Health integrated managed care folks today. So individuals who are enrolled in the federally subsidized Apple Health Medicaid program. We also cover dental services in Apple Health Expansion, and those will be covered and paid for directly by the Healthcare Authority. In addition to physical health and behavioral health, we will also cover non-emergency medical transportation. So transportation to and from appointments and to receive pharmaceutical drugs. We will also, of course, cover interpreter services for this new program as well. When I talk about mirroring the benefit, we're doing our very best to do that. So whatever individuals are experiencing today in our Apple Health federally funded Medicaid program will be very similar to what new enrollees will experience in Apple Health Expansion. There are a couple of key differences. The pharmacy benefit is one. The drugs and the benefit coverage will be substantially equivalent to what integrated managed care or federally funded Medicaid receives today, but some of the drugs may look different. So for instance, you may receive a brand name drug if you're in Apple Health integrated managed care or the federally funded program. In an Apple Health Expansion, you may receive the generic version. These are tied to what we call a preferred drug list or PDL. In Apple Health for Medicaid, so that federally subsidized Medicaid program, the federal government has arranged for rebates for some of those brand name drugs. Those rebates won't be available to the agency for Apple Health Expansion. So in order to keep costs down, but to mirror the benefit, we'll be using the preferred drug list that's associated with our Public Employee Benefit Board coverage. So it will be the same preferred drug list that I received today as a state employee. We'll move into the next slide and cover some additional information. I noted that there are several Apple Health programs that cover undocumented and uninsured individuals in the state today. The new qualified health plan expansion, that plan that you can purchase off the exchange, that our health benefit exchange partners will talk about here in a moment, will include people will enroll in that plan, we expect, who will also be eligible for Apple Health expansion. For individuals who purchase a plan on the exchange, come July 1st, if they are eligible for Apple Health expansion, we will transition them over into the new program. There are two reasons for that. This program will provide free coverage and save them the cost of the premium. They will also lose some of the federal or some of the state subsidies that are associated with the QHP, the qualified health plan that they have purchased on the exchange. Now, we will do some outreach between the two agencies to ensure that individuals who are transitioning between the two plans understand their options. And if someone wants to stay with their qualified health plan, they will be able to do that. So as we move forward and talk about privacy, I noted that that was one of the barriers, right, to access, is really understanding privacy. And I think specifically for this population, we want to highlight some of the elements that we already have in place today. As we noted, Apple Health has been serving the immigrant community for a while. And while we could always improve and continue to look for ways to improve our privacy standards, we have very, very tight privacy standards currently. Under law, Healthcare Authority is required to maintain the privacy of its clients. We are subject to HIPAA. There are a limited number of reasons where HCA may use and disclose information, and this includes the information that we use to determine your eligibility or community members' eligibility for Apple Health coverage. There's a full list of these disclosures in our privacy policies on our website. And as Sarah noted at the beginning of the webinar, we will be providing all of those links via email to individuals attending today. As we move on, we have a little bit more here about privacy. The privacy policies listed below are provided to clients on a yearly basis. And I think the other thing we really want to highlight is that we do not share information with an immigration agency. I think that's an important element to recognize, and I just want to pause there and remind our folks of that. Again, a few more links. We'll make sure that you receive those via email. And then, of course, the slides will be available on our website as well. As we move forward in the slide deck, we want to talk a little bit about public charge. So U.S. Citizenship and Immigration Services processes immigration and naturalization applications and receipt of Medicaid benefits when an individual applies for legal permanent residence in the United States. So there are some policies regarding immigration services that we should be aware of. What we note here is the only benefit that's considered for the public charge test is long-term care, such as a nursing facility. If you think back to the services that we discussed that are included in Apple Health expansion, you'll note that I did not say long-term services. Long-term services are not included in Apple Health expansion at this moment. The next slide gives you some additional resources about public charge. So again, we'll make sure that you have access to these links as we move forward. All right. Confidentiality and safety. So you'll note here that we're here with our Health Benefit Exchange partners. We are also working very closely, Health Benefit Exchange, Healthcare Authority, and DSHS, to ensure client privacy is upheld. We will not share information about clients with anyone unless we're authorized to do that. So just want to highlight that again. People who are enrolling for Apple Health expansion can use the Health Benefit Exchange's Health Plan Finder. They can also use the DSHS Washington Connections route. So there's still the two pathways available to that. So it's really important to highlight that all three agencies are on the same page about confidentiality and privacy. And I think we really also want to stress language access and interpreter services. So the Healthcare Authority provides language access services in written and spoken word. We also have sign language that includes American, Russian, Ukrainian, Vietnamese, Cambodian, and Mexican. You can learn about our language access online at that link. And again, we'll make sure that you have those links available to you. So with that, I think we'll move into community outreach and engagement. So like I said, we've been partnering with DSHS and Health Benefit Exchange, and you've seen a lot of outreach activity from our Health Benefit Exchange partners. And in a minute here, Joan will start to talk about that qualified health plan and give an update there. We've really allowed sort of a first phase of this where HBE is talking about their new qualified health plan expansion. Now that open enrollment is in full swing, as it tapers down, we will really start to talk and do outreach activities around Apple Health expansion. So we kind of think of that as the second phase in this state effort. HCA is looking to develop outreach materials that can be translated in many different languages. We've heard from some of our community organizations that there are dialects that we also need to be sure that we address that need to be translated in both oral and written. We'll work together with those community members and community organizations over the coming months to hope so that we can ensure that we are providing good access materials that are culturally appropriate. We will be doing webinars such as this one as we move closer to implementation. We'll use these webinars to provide updated information about enrollment, eligibility, and elements of the Apple Health expansion program. And where necessary, we will make sure that we continue to partner with our Health Benefit Exchange partners to ensure that they're here to give updates on how the QHP expansion program is rolling out. I'll also note here that we have a temporary community engagement advisory committee. For the last couple of years, the Healthcare Authority and the Health Benefit Exchange have been meeting with a number of legal and community advocates to discuss these two programs as they were under development. We recognized that it was time to pivot those and really open that up to community members. So we did, at the end of October, expand that membership and rename it to the Temporary Community Engagement Advisory Committee. And we invited community-based organizations from across the state, representing a variety of different immigrant communities and individuals with lived experience to provide feedback and input on program development for Apple Health expansion and outreach for both programs. So with that, I think that is what we had to cover today for Apple Health expansion. And I think I'm going to pass this over to Joan Altman with the Health Benefit Exchange. Joan?
Hi, everyone. Good evening. Thanks, Becky, and thanks so much to Healthcare Authority for inviting the Washington Health Benefit Exchange to participate in this webinar. And thanks to the over 500 of you who have joined us today. My name is Joan Altman. My preferred pronouns are she and her. And as Becky mentioned, I direct our government affairs and strategic partnerships over at the Washington Health Benefit Exchange. My number one top message for all of you tonight, if you are working with clients and others who are newly qualified under our recent expansion, would be that we are in open enrollment now. And as of November 1st, anyone, regardless of their immigration status, can come to Washington Health Plan Finder, which is wa.healthplanfinder.org, and sign up for coverage. We've had over 8,000 people come in already since November 1st to look at and explore their health options. This includes both people who are able to purchase coverage at this time and those who cannot for various reasons, including the affordability barriers that remain. When someone comes in and sets up an account in Washington Health Plan Finder, that's advantageous for several reasons, even if they do not end up purchasing coverage at this time. As Becky mentioned, when the new free Apple Health program becomes available in July, we will be helping to transition anyone who is able to come in and purchase coverage now. And we will be doing very concentrated outreach to everyone who has come in, applied for coverage. We see that they're eligible for coverage. Even if they haven't been able to sign up and enroll in coverage, they will get simultaneous outreach at the same time. So for everyone who's come through already entered their information, determined their eligibility, they will be getting sort of concentrated, focused outreach that is advantageous, whether you are able to afford coverage right now, or you are someone who's going to be waiting till later this summer to sign up. So those are, I'm front loading the messages. I will now go through the regular scheduled program and look forward to questions if people have them during the live Q&A. Again, you can see here, the left-hand side of this graphic is what I'm here representing, the new coverage expansion that started November 1st. Very excited to work in partnership with Healthcare Authority for the right-hand side of this graphic for the Apple Health expansion starting July 1st. The next slide shows you a bit about the programs that you can come in and qualify now through Washington Health Plan Finder. Anyone can come in, anyone can purchase health and dental coverage for the first time in the history of the exchange. Everyone can access the new Cascade Care plans, which are plans that if you sign up for a Cascade Care plan, you can be eligible for a new state subsidy that makes plans more affordable, even if you don't qualify for any federal financial assistance. And again, there's an income limit on the state subsidy, but it's everyone up to 250% of the federal poverty level, which is anyone making up to approximately minimum wage. The next slide just provides a little bit more information on how we were able to offer this extended coverage, and feel free to click through the bullets. I'm sorry, they're fancy here. Essentially, we got direction from the state legislature to apply for a waiver. There are waivers that allow you to waive parts of the Affordable Care Act under various restrictions, but we were able to waive the section of the Affordable Care Act that typically prevents people who are undocumented from signing up for coverage. So as a result, people can come in and get covered. We were unable under federal law to waive the provision that says that people who are undocumented cannot get federal financial assistance. So that is where you see an affordability barrier that persists today. The next slide provides some additional information about the affordability barrier we know people are continuing to face. You'll see in front of you an example of a 35-year-old customer who's making, just under $25,000 a year. If this person is signing up for a Silver Cascade Care plan with the income that qualifies you for the state subsidy, you see how the costs compare for people who qualify for federal subsidies and people who are undocumented. So in this hypothetical example, you have a premium that's, just under $400 a month. For someone who qualifies for federal tax credits, you take $366 off that monthly premium. The rest is covered by your Cascade Care savings, your state premium subsidy. And as a result, your monthly premium payment after all the applicable subsidies are applied is $0. Now, for people who are undocumented, you have that same monthly premium price. You get up to $250 off per month as part of the new state premium subsidy program, which cuts your bill in half. That being said, you're still left with a premium of just over $120, a monthly premium that you need to pay in order to maintain your coverage. So for people up to 138% of federal poverty level, those are folks that, if they're income eligible for the new program and otherwise eligible for the new program, will be transitioning to the zero premium, zero cost share program that's coming in July. For others who are over that income limit, we know that there'll be sort of a premium responsibility that people will need to continue to meet. There are just over 800 people who have come through and signed up for coverage already. They've selected a 2024 plan, and about 500 of those people are under 138% of the federal poverty level, so they appear income eligible for the new Apple Health expansion come July. A key difference that I want to point out here, Medicaid enrollment is open year-round. You can come in any month and get coverage. Qualified health plan coverage, typically you have to come in during open enrollment, which is from November 1st to January 15th to sign up for a plan. The one caveat I'll mention here, if you are someone who is eligible for these new Cascade Care savings, if you are up to 250% of the federal poverty level, you can come in throughout the year to select a plan. So I'll say that again, and we can clarify in the FAQ as needed. Typically, when to sign up for a qualified health plan, you must come in and buy your coverage for 2024 between November 1, 2023 and January 15, 2024. If you are working with clients and customers who are lower income, who make up to 250% of the federal poverty level, they are not constrained by that open enrollment period. So someone could come in and purchase coverage in May or June. And those would be people who are signed up and would sort of be eligible for us to then help transition them over. The next slide speaks a bit to the community engagement that we've been doing in advance of the launch. Again, feel free to click through these bullets. I want to acknowledge the work of Jenny Arredondo and our outreach team, our navigator lead organizations and community, and several of the folks on this call who participated in some listening sessions and some landscapes cams that led to the development of our education and outreach campaign in partnership with VITA. We've been developing materials and are continuing to iterate and provide additional languages as we go through the launch and we learn more about the communities that we're serving. The next slide points you to the link that takes you to several of those materials in our partner toolkit. We also did a webinar earlier in the fall talking specifically about the expansion and the privacy protections and how Health Plan Finder works and what people need to do to sign up. We've provided some links there as well. And finally, you can see here, we provided the information on where you can go to get free assistance if you or someone you know needs help signing up for coverage, either from our free trained assisters in community or from our call center. And we've included the link there to the landing page on Washington Health Plan Finder that'll take you to resources and help you direct you to where you need to go to sign up. I will say the questions that we've received in advance of the launch and since the launch, Becky touched on them already. You know, will applying for health insurance through Washington Health Plan Finder impact your immigration status or citizenship application? No. Will getting health insurance that's available through Washington Health Plan Finder make you a public charge? Again, no. And, you know, is my information safe? And again, we'll echo what Becky mentioned earlier. The information that's entered into Washington Health Plan Finder is used only to determine your eligibility for health coverage. It's not shared for enforcement purposes. And as part of negotiating the waiver that expanded coverage to people who are undocumented, we negotiated additional privacy protections at the federal level for people coming through Health Plan Finder. So no identifying information is sent to any of our federal partners related to people who are undocumented or people without a social security number who are seeking coverage. So those questions and more are answered in some of the outreach materials we've developed. And again, happy to answer more questions as they come up. And thanks, Becky. I'll turn it back to you. And Sarah and Co.
Thanks, Joan. Appreciate that. And our continued partnership here. So I think we really wanted to provide some additional resources. And again, those will be in the web or posted on the website rather, and part of the slide deck. So here we have our Gov delivery system. This is a great way to stay connected with all things Apple Health expansion. So this is an automated email, rather, my apologies, that you can subscribe to. And as we have new messages, policy updates, program updates, anything like that, we'll generally send those out through our Gov delivery. And so you can receive those emails by subscribing here. We'll go to the next resource slide. And I think this is a great compilation of all the different links for both the Healthcare Authority webpage and email. So if you have a question specific to Apple Health Expansion, that webpage and that email address are open and ready for you to utilize. And the same for our Health Benefit Exchange partners. There are two web pages here for your reference. And then I think the next slide talks about how to apply for coverage through Washington Health Plan Finder. So it provides that link once again. Then on the next, I think we are ready for our live Q&A. And I think, Sarah, you'll help navigate this one for us, right?
Yes, I have been monitoring the question and answer already that folks are putting into Zoom. And so let's kick off. Let's see. Can you please clarify if this Apple Health expansion will include people who are lawfully present, quote unquote, non-qualified folks, or only quote unquote undocumented?
That's a really great question. And I know we have two of our eligibility experts, so two eligibility program managers online, Giovanni Delgado and Sheldon Fronte. I think the answer to that is that we are looking for undocumented. So lawfully present is an immigration status. And our experts will check me on that if I'm incorrect. Gio and Sheldon. You're on mute, Sheldon. It's okay.
Sorry. Yes, they should be eligible for both, but we can double check that. The last I was looking at it, they should be eligible. Both those categories should be eligible.
Okay. Oh, thanks, Sheldon. Thanks for correcting me. I appreciate that.
So our next question has to do with privacy and safety. How long does the application remain in the client file?
That's a great question. I don't know that I know the answer to that. I'm not sure if anyone on the line does. We may have to take that one back, Sarah.
Okay.
Yeah.
What about, is the Health Home program eligible for the Apple Health Expansion program?
That is another great question. Health homes are not included in Apple Health Expansion, though the connection to primary care and to care coordination across the spectrum of services is available through a managed care organization.
The Apple Health Expansion goes live on July 1st, 2024. Is that the coverage start date or the enrollment start date?
That is the coverage start date. I think we'll be publishing and sending out an update as to when the application will be available. And again, I'll ask Sheldon and Gio if they can help there if I've answered that one incorrectly.
During the presentation, oh, I'm sorry.
Sorry, I was just going to say no. That's correct.
Okay, during the presentation, Joan said, come and inquire about our plans. Does that mean online or a physical place?
Thanks, Sarah. Anytime someone says Joan said, I get nervous, but there are several different ways that people can explore their health plan finder options. The first is obviously you can go to our online website and use some of the customer support tools that are on the site to work your way through the process and the plan options. You can also call our customer support center. It's a Spokane Valley-based call center. We have agents there who can take your plan information and answer questions you might have with language that's supported. Over 240 languages are supported through the call center. You can also chat online with a call center representative if you are someone who likes chatting online. And for people who would like to set up an in-person appointment or go visit a physical space, we have trained assisters and brokers throughout the state that have enrollment centers you can walk into or have physical locations that you can set up in-person appointments in so that you could bring documents or bring questions you have and connect with them as well. So in that resources slide that you'll have access to through this presentation, you can see the enrollment centers and the navigators in your area. You can see our call center number, and it has the link to Washington Health Plan Finder as well. Thanks for the question, appreciate it.
Thank you. The next one I believe is also for HBE, and I think Jenny said she would answer this one. If someone were to be paid under the table, how would we add that to their income?
Yeah, I'll start with this answer, and then I know that our colleague Joanna is working through some of these in the chat as well. We have lots of people through Washington Health Plan Finder today who are part of the gig economy, who are seasonal workers, who have an income that fluctuates. So there are all of the ways in which you enter and verify income today are the same tomorrow. So we have income verification procedures that are used to verify income that's reported through Washington Health Plan Finder, and nothing about the expansion is changing any of those procedures. And it involves sort of confirming the income you enter against various federal and state databases, and so forth. So I'll start that as an answer and see if that clarifies it. Joanna, Jenny, if anything else to add, feel free, and otherwise we'll look to just answer those in the chat.
All right. In reference to an earlier question, what proof or verification of income will Apple Health expansion applicants need to provide?
So it'll basically be how it currently is. There'll be a self-attestation, and we're still currently working on what it's going to look like to verify income, but it's going to follow what the current process is for Help on Finder when people go into there and self-attest to their income.
For those who do not have a bank account or form of payment, are money orders accepted?
Sarah, I can start with this one, and happy to defer to HCA experts on the line as well. Again, with Washington Health Plan Finder, with the people who are both documented and undocumented who've come through Health Plan Finder to be screened for available Apple Health programs and who end up being eligible for qualified health plans, there's a range of payment modalities that are accepted. So for people who may be unbanked, we've worked with carriers to accept various forms of payment, including sort of prepaid debit card type things and money orders. So again, we'll look to Joanna to keep me honest, but each carrier has a range of payment options that they'll accept and can work with customers on.
All right. When switching, or when somebody signs up for that qualified health plan from HBE, and then on July 1st, they're eligible for the Apple Health expansion plan, can they stay on that qualified health plan? Do they have to move over?
Yeah, that's a great question. People who would like to stay can. I will say that if you are eligible for Washington Apple Health, you are not eligible for any applicable federal or state assistance. So to the extent that you would like to stay, you would be paying the full cost for your health coverage.
Will DACA individuals be eligible for the Apple Health expansion? Is this one too tricky for folks to answer at this time?
I'm happy to start, Sarah, and happy to let others. Go ahead, Juan.
Yes, they will be eligible since DACA currently is considered undocumented for Medicaid programs. They will be eligible for the expansion.
And my only add there, Sarah, is that people who are DACA recipients are also eligible to come in for the qualified health expansion now. There is a federal rule pending that would change the status of DACA recipients from not being considered lawfully present to being considered lawfully present. That rule has stalled, and to my knowledge, most recently, it has not been advancing, but it's something we continue to watch at the federal level.
Is behavioral health covered under the expansion program?
I'll answer for Healthcare Authority's Apple Health Expansion Program. Yes, behavioral health care is covered, behavioral and physical health.
Will the Apple Health expansion also be applied to individuals over the age of 65 that may not be eligible for Medicare?
That is a great question, and I'm so glad someone asked it because I had it highlighted for myself on the slides to really emphasize. So yes, recognizing that Medicare is not available to individuals over the age of 65 who are uninsured and undocumented in our state, the eligibility for Apple Health expansion is 19 plus. So that does include our elderly folks and those over the age of 65.
Let's see. Will the Apple Health expansion, when it starts on July 1st, 2024, will those clients have access to 90-day retroactive medical?
Sarah, I think that's another great question, and I'm going to take that one back. I think we really need some technical experts to answer that one. It gets a bit complicated, so just want to make sure that we get the right answer. I think that's a great one to have on our frequently asked questions, and we'll make sure that we follow up with folks on that.
All right. For unmarried, undocumented couples who would like to apply for the expansion, do they have to apply separately or together?
That's another great question. I don't know that I have the specific answer on that. Sheldon?
Yeah, they would, if they're married and they're living in the same household, they would want to be on the same application and fill it out through Help and Finder or Washington Connection, depending on their age.
All right. Will qualified immigrants who haven't met the 5-year bar and aren't yet eligible for federal Medicaid be eligible under this expansion?
So the 5-year bar folks, unfortunately, are not eligible for Apple Health expansion at this time.
And Becky, I will note there that people who are in the 5-year bar are eligible to receive federal subsidies and state subsidies through the exchange and federal cost sharing assistance. So the hope would be that people who are in the 5-year bar are still able, even though they wouldn't qualify for the $0 premium, $0 cost share program, would be able to come in. And for people who are lower income would get the most generous federal premium and cost sharing subsidies that are provided.
Thanks, Joan. This is why we do these webinars together.
We have another eligibility question. This one is about individuals with political asylum. Are they eligible?
And I am going to have to defer to my eligibility experts. We may need to take this one back, but I don't want to steer anyone wrong here. I don't know, Sheldon and Gio, if you're prepared or not to answer that, but we may need to take that one back, Sarah.
Okay.
And
Joan.
Becky, my only add here would be anyone of any flavor of immigration status. There are a lot of nuances. You know, there are immigration attorneys whose life work is parsing these differences, but for anyone who thinks they wants to know more about their eligibility, coming into Washington Health Plan Finder, entering your information, there are places where you can indicate if you're on any type of visa or special status. Washington Health Plan Finder will screen you for all the available programs, whether they're Apple Health programs or federal or state subsidies. So that's one way, if you're uncertain, coming in, creating an account and seeing what you're eligible for today will help sort of provide more information about what you might be eligible for moving forward.
All right. Can an individual, this is for you, Joan, purchase a qualified dental plan without selecting a qualified health plan?
Yeah, I would say typically you come in and you purchase a qualified health plan and then you can purchase a dental plan. If you only want the dental plan and you don't want the health plan, then you are able to continue the dental plan coverage, even if you discontinue the health plan coverage.
So this is another eligibility question. If an undocumented person on this program subsequently gets LPR status, will they be terminated?
I am going to ask, I'm not sure, Sheldon, Geo, if you're not coming off camera, I'm guessing maybe we need to take that one back, but go ahead.
Yeah, I think at this point, it'd be kind of the same situation for like someone that becomes pregnant. We would move them to that program. So if someone now has a status that would make them eligible for full Washington Apple Health, they would more than likely get moved to that program if they've updated their status timely and everything with us. And Gio, you can add to that if you want to.
Yes, that's correct.
Thank you, Sheldon and Geo. And I would note too, that when we move individuals from one program to another, they are notified, they do receive information about that movement. So they're aware.
Okay. So for clarification, after July 1st, if an undocumented citizen is seen in the emergency room for an emergent condition, would they be applying for AEM medical or Apple Health expansion?
So that is a great question. Sheldon, did you want to go ahead?
Yeah, I mean, if you want to, you can. I didn't know if you were
No,
going to answer.
please go ahead.
Yeah, so they would apply for Apple Health expansion, and if they weren't eligible for Apple Health expansion for whatever reason, then AEM would be kind of the program of last resort that they might be eligible for.
I think the other thing that I would note here is that, given Apple Health expansion has a limited number of enrollment spots, that the emergency medical services program will continue. So in its form today, we will continue to have AEM available even after Apple Health expansion enrollment has been met. So just want to highlight that for folks. I know we get that question quite often. So I want to make sure that we address that as well.
Which MCO would an Apple Health expansion enrollee be assigned to, or do they get to pick?
That's a great question. When people are eligible and enrolled into Apple Health expansion, they will have their opportunity to choose a managed care organization. And then once, if they opt not to, or they don't click or choose a plan, they will be auto-enrolled. We do have an algorithm that works behind the scenes there that is just sort of randomly adds people to managed care organizations. We do try, if there are multiple people in the same household, to enroll individuals into the same MCO.
Okay, and we have time for just one more. And this one is a technical question. Will providers require additional contracting for these expansions, or is it included in their current contracts?
That is a great question. And I think that is still one that we are working through right now with our managed care organizations. So more to come on that one. But appreciate that question for sure.
And all the questions that we have not answered today, or we answered in chat, we will look through these and combine them into one document, a frequently asked questions document that we'll post on our Apple Health expansion webpage.
So I think we're going to move forward, right, and talk about the Mentimeter or the survey. So you'll receive this survey link, will be emailed to participants and to people who registered for the webinar. If you participated in today's webinar, we are especially interested in hearing from you. Questions include things like what languages we need to translate this slide deck into, what other information we could provide for you. And we do ask about future webinar topics. So really would appreciate you taking a moment to fill out that Mentimeter survey. And then questions, as usual, these are great email boxes here for both the Apple Health Expansion and QHP, should you have any questions at all. And I think Joan, our Healthcare Authority and Health Benefit Exchange teams, we really do thank you for your participation today. Joan, anything in closing?
No, just appreciate everyone's help spreading the word about these new coverage opportunities. I know the focus of today was really looking ahead to July, but to the extent that you are out there in community working with people who could benefit from either a current program or our new qualified health expansion, or who want to sort of be all set up in our system and ready to go for July 1, sort of highly encourage people to help spread the word in your community and to reach out to us if you have any questions and or if you're seeing any barriers to reaching people in community that you need help addressing.
Well, thanks everyone again for joining, and much appreciation to Shelley Hansen, our translator, and our closed captioning individuals I know who've been working furiously behind the scenes, and everyone here at Healthcare Authority and Health Benefit Exchange who's helped to prepare us for the webinar today. Thank you all.